So I'm going to talk a little bit about what community health workers do, and I'm very excited that there's a huge interest in community health workers to be embedded in dentistry offices, practices. It's very dear to my heart. I advocate for community health workers. I advocate for my community. I advocate in a bunch of other things in my role, trauma-informed care, mental health. My main work is child development, parenting, but with community health worker, I'm gonna, speak on a bunch of other things here. But standing in the gap as community health workers is a huge thing. So on the agenda, I'm going to speak on the purpose. Who are community health workers? Why have community health workers roles and responsibilities? The definition that the licensed practitioners of healing arts are working towards in making community health workers billable, which is a huge thing right now, and components of the state plan amendment all wrapped in it. Best practices in the other states coming together, and resources and how you can all get involved. So again, I'm excited to be here. It seems as though this has, so far the presentations that I've heard this morning, seems to be such a great segue into getting into this presentation. And so the definition that we go by is through the American Public Health Association and community health workers. Who are they? Community health workers are frontline public health workers who is a trusted member of and or has an unusual close understanding of community that we serve. We have trusted relationships this trusted relationship enables the worker to serve as a liaison, link, intermediary between health, social services, and the community to facilitate access to services and improve the quality and cultural competence of service delivery. A community health worker also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, and social support and advocacy. I would add that community health workers are someone that stands somewhere in between social workers and behavioral health specialists. We get a lot of referrals from both of them, and we kind of stand in the gap somewhere in between there. I'll explain more. Why community health workers? We represent the community we serve. We have shared life experience. We improve communities, right? So I live in the community that I serve. So I'm from Allentown, Lehigh County. I grew up there. I've been there since I was 6 years old. I do home visits. A lot of the community health workers, we do a lot of home visits. We meet them in the clinic. We may meet them at McDonald's. We may meet them at Dunkin' Donuts. I may meet them at the park. I may meet them at the shelter. That's who we are, and that is what we do. Wherever they are, wherever they find themselves in lives, that is where we are. That is where we go. That is where we find ourselves with them. Wherever they go, that is where we are. Shared lived experience, right? I've had diabetes. I have asthma. I have several mental health diagnoses. I've been unemployed. I've gone to the food bank. I know what it's like to apply for medical assistance. I know what it's like growing up and going to the shelter. I know what it's like to go to unemployment office or call and just be on the phone forever. So I know what it's like to be there and advocate for my clients and be there with them calling, applying with them on Compass, DHS application and saying, okay, let's do this. Let's go through this process. But my job is to empower them. So I'm going to show them but I'm also going to teach them how to go through the process because I'm not going to be there forever, right? So I'm going to show them how to do it, and this is the next step that you got to do, because 6 months from now, you're going to have to do it again, right? So I'm going to have to show them. So I'm improving some things in my community, and I'm empowering them to make those changes because they're going to have to do it the next time, right? We reduce hospitalization. How? Well, the provider in the clinic is going to send me a referral because maybe they no-showed a couple times, right? So now I'm there, and I'm knocking on somebody's door to find out, well, you know, you've missed a couple times with your child. Is there some resources that I could help you with? Is it that perhaps you lost your medical assistance and you need the application completed? Can I help you with that? Do I need to assist you and apply for transportation? Let me help you with that. Is it on-track or LIHEAP application, weatherization? Is it something like that that is preventing you from going to the appointments? I have to meet these needs and these resources first and take care of what's going on here, because that's what's going on, and you can't make it. You're not thinking about this. You're thinking about what's going on at home, right? And now I could go to the provider, to the doctor, and explain to them, this is what's going on at home. They have no heat in their home. You have a family of 5 living in 1 bedroom with a plug-in heater trying to survive, and they only come out of there just to eat a meal and go back into their room. Survival mode, right? Been there, done that. So I can relate as a community health worker. Contribute to improved health outcomes. So kind of both improving community and contributing improved health outcomes. You know, I could go to community meetings that they have for socialization, bring out people from the community in my area and say, hey, they're gonna have a meeting over here at this church. We're gonna talk about diabetes tonight. One of the doctors are gonna come out and they're gonna have a discussion. Would you like to learn about it? What is your interest for next month? Is it ADHD? Would you like to bring your children? We're gonna have childcare. We're gonna have food, right? So we're improving our community, right? We wanna hear about our community. What is your interest? We're serving our population, right? As community health workers, we really get in there to hear about our community and make those changes. Control Medicaid spending. So with Medicaid spending, according to a 2020 Penn Center for CHW study, every dollar spent on patients receiving support from CHWs resulted in an annual return on investment of $2.47 for every dollar invested annually by Medicaid, mostly by reducing hospitalization. Hospitals won't get paid if a patient is readmitted within 30 days. Now, I'm going to talk about this one here. Role of CHW in addressing gaps in health literacy. Role of CHW in integrated patients, dental providers with any other care teams like medical or behavioral health. So let's talk about that, right? I'm going to talk about it a little bit. So CHWs, cultural mediation, right? We understand different cultures. Again, we're from our community. We understand the population. Care coordination. So again, if I assist them in applying for LIHEAP or On-Track or Compass or anything like that, I also follow up with their caseworker. I may follow up with the On-Track program. I may make the calls. I'm gonna have them with me because I'm gonna show them how to do it, right? I'm doing care coordination. I may also communicate with the behavioral health specialist. I may communicate with the social worker. I'm doing care coordination, right? I'm picking up the phone and saying, hey, I'm working with this client. What's going on with their case? What is the follow-up, right? Sometimes these organizations, they just put the paper down, got the application, I'll work on it. But when they find out a community health worker is, working with them, then they're like, uh-oh, I better get on it, And that's something worth it, right? Care coordination, also, you talk about health system, human service navigation, health education, self-empowerment. Again, I talked about all of that, right? It's something that we do. It's something that comes natural. We talk about self-empowerment, health literacy. When we complete those applications, we're saying, okay, go ahead, start filling this out. That's where we find out they may not understand the application. They may not understand what they're writing. And so that's when we connect them to GED classes, maybe ESOL classes, maybe, connect them to all these services that they need, right? We can help them along the way so that then they are connected to all those resources that will help them to be better parents, right? Because again, my job is child development and parenting, and so I'm gonna empower them to have those services, to get the literacy that they need to be where they need to go, right? Connect them with Career Link for jobs, to get those trainings that they need, right? Move on to the next one. And so for here, we did a survey for sustainability financing for community health workers with 100 employers that employ community health workers. And so we have 478 CHWs represented on this, and out of them, 242 are certified community health workers. I sit on the Pennsylvania Certification Board as well. And so we have them in community-based organizations, 39% of them. I will say that you all would fall in the other category if you had a community health worker. Now, because you have interest in having community health workers, that would increase, and I would love to see that increased. And so there are ways to get funding to have community health workers. And I will say that the impact a CHW can have in a dental practice or non-clinical versus direct patient care, and the role of community health workers in advancing oral health and seeking oral health care. I would say if you had a community health worker in the dental field with you, how would it work? Well, a community health worker can follow up with that patient and contacting them after they had a procedure done. Hey, how's everything going? Did you have to follow up with your PCP for any type of issues that you may have had happen? Do you need any services? You have a follow-up coming up in a month. Do you need any resources, any food? Can I connect you with a food bank around you? Are you having any issues accessing that food? Maybe I can pick it up for you in a food bank. Do you have lack of insurance because maybe it lapsed between last month and this month? Maybe I could be that connection and get it open for you. Maybe I could connect with the mental health provider because something happened. That's going to prevent a no-show for the follow-up because they need to follow up after a surgery or after a major procedure. There's certain ways that you could utilize a community health worker. If a new community health worker came on board, they're going to get a training first through AHEC, through Temple, through all these different places. There's many trainings that they could utilize. You hire a community health worker, they get trained first, and then they get the certification, and then you train them as if you want them to learn a specific thing, you're the one that would train them on how they go about it, and then they would follow up with these patients after a procedure would be done. And then they will follow up with them in a home. They would go through nutrition. They would go through, whatever it is that you need them to go through after a procedure. Certain main points. That's what you would teach them. But they're taught on cultural competency. competency. They're taught on how to do resources. There's a lot of things that they are taught on, but you could equip them on different